The Lagos State House of Assembly has called for the accreditation of more private hospitals to treat those infected with coronavirus. This formed part of their deliberations at Thursday's Yoruba plenary. Abimbola Agbebi has the story.
The fight against the coronavirus pandemic is getting tougher, with Nigeria crossing the 30,000 mark of the COVID-19 infection. Lagos currently has 11,670 cases, with 133 deaths recorded and 1,698 cases discharged.
If you look at it today, you will see that average of one person per street is having COVID now. By the time we analyze it properly, by the time we test all the citizens of Lagos State, you will see that there's no way we will not have up to about at least one per street. We need to expand our scope. How do we do that? We need to include the private practitioners, health practitioners. Everything will not be centralized only on the Lagos State isolation centers any longer.
Worried about the rise in the cases in the country, the lawmakers want the state government to allow for more private hospitals to treat persons infected with the virus.
Presently, we don't have any private involvement in the treatment of COVID presently, and that is exactly what we're talking about, that we need to include them. Now we have private laboratories. A lot of people will now be able to access laboratory to test if they have COVID or not. But after few days or few weeks of running of these private laboratories, you will see very great increase in number of people having COVID-19. We need to be proactive to find a solution before the problem.
In the motion titled Need to Allow Private Hospitals Participate in the Treatment of COVID-19 Patients, moved by the House Committee Chairman on Health, the lawmakers believe that private hospitals have facilities that could help support the fight against the spread of the virus. The lawmakers are confident that the accreditation of more private hospitals in the state for the treatment of the COVID-19 pandemic would help flatten the curve of the spread of the virus. Abimbola Agbebi, TVC News, Lagos.